Use new ACL Return to Run testing. Now, functional tests measure quadricep strength are commonly used to make return to run decisions. These are frequently used after ACL reconstruction and many knee injuries and knee pathologies that we'll commonly see with patients. But here's the thing. Single leg hop tests are most common, and you've probably done a lot of these single leg hop tests yourself. Some of those tests include the single leg forward hop and vertical jump. However, those two don't really accurately measure quadricep strength. This leads to an overestimation of quadriceps activation, and it's already known we have overinflated, overestimated limb symmetry index values, and that's going to create a higher risk to injuries. So in that case, instead of using the single leg forward hop and vertical jump, we want to instead use functional tests that are going to be better isolating the quadriceps. And this comes in the form of the single leg backwards hop test. So let me give you a summary here of clinical pearls. Single leg forward hop and vertical jump test overestimates quadricep strength. Single leg backwards hop is most effective to measure isolated quadricep strength. Single leg backwards hop is a clinician-friendly test with minimal setup and time investment. And important to note, 7 practice jumps prior to the official data collection for the backwards hop is going to be indicated. So let's compare these hop tests so we can get a better idea of why potentially this backward hop is the best. So forward hop tests are going to be commonly used after ACL reconstruction along with vertical hop tests. However, both of them are going to unfortunately not isolate the quadriceps as much as we want to. Now with the forward hop, unfortunately the forward hop doesn't really activate the quadriceps that much. It's fairly low, and it isn't isolated from the hip and ankle musculature. On the other hand, the vertical hop does a great job of being able to activate the quadriceps, but it's also equally engaged with the hip and ankle musculature as well. So your LSI, your limb symmetry index, is going to reflect muscle activation at the ankle, knee, and hip equally for the vertical hop, while the forward hop test is actually going to really be overestimating your quadriceps because you're not isolating it and activation is pretty low. So if you're really good at a forward hop, you think you're going to be safe to be able to return to running, and you tell your patient, great, go ahead and return to run. They have a re-injury. Unfortunately, it's probably because you didn't isolate the quadriceps. You don't have a really good idea of how much strength that quadriceps has. So how is the backwards hops better and isolated? Well, the backwards hop is going to isolate the quadriceps, and it's going to isolate it from the hip and ankle, which is really, really important. So let's get into that a little bit more, but I want to break this down for you so you can see it. Now, there is strong evidence for the forward, backwards, and vertical hops to make return to run decisions. I don't want to discount the fact that these tests are used. However, only the backwards hop is really going to isolate the quadriceps muscle strength. Now, the forward hop, as we mentioned, is going to have low activation for the quadriceps. The forward hop, I would really say caution you to use an LSI. However, know it's overinflated, know it's overestimated. And if you want to learn a little bit more about the LSI, the limb symmetry index, you can check out Runner Resources. They have all the information there. But the LSI is going to be the result of the involved limb divided by the results of the uninvolved limb. And then you're going to multiply that by 100 to get a percentage. Now, for return to run, we want our percentages to be over 90%. But big research came out years ago that said that LSIs were overestimated for forward hop. So again, that's why we're talking about this, is because we've known for a little while that forward hop is an incorrect number, and we want to make sure that we have a better isolating test to use. And lastly, we talked about the fact that the vertical hop is going to activate the quadriceps equally with the hip and ankle. But if your hip and ankle are already strong, and then the quadriceps can kind of hide underneath it, well, you might get overinflated quadriceps activation, or what you think is overestimated, or what you think the quadriceps is activating, and it's really just hiding behind hip and ankle musculature. Clinicians should use the backwards hop, and that is what I want to go over with you right now. Again, remember, the LSI should be over 90% to return to running for these. Single leg backwards hop. Okay, so what you want to do is you're going to have your patient stand. You're going to have them put their heel at the start line, hands on the iliac crest, holding the non-jumping hip and knee close to 90 degrees. You're going to instruct that patient to jump as far as possible and not move upon landing. They need to stick to landing. Perform 7 practice jumps and then perform 5 successful jumps. Record the distance of each jump, and you're going to perform it bilaterally to get your LSI. Important to note is the criteria for successful jumps. Upon landing, you cannot move your other foot. Upon landing, you can't move your foot for a minimum of 3 seconds. That's an important thing. And your hands must remain on the iliac crest during the entire jump. You also must keep the non-jumping leg in the start position and not deviate more than 3.5 centimeters wide. So, backwards hop. We know what to do. We know what's successful. We know the information behind it and why it makes it successful. So, how can we use the backwards hop test to be able to guide exercise prescription? Well, strength training to improve backwards hop tests can be focused on knee extension. And there's some good research that's going to support slow and heavy resistance training. And these are going to include single leg scoots, stool scoots, under heavy load. So you can do it with a resistance band. You can also do it with a weight. Backwards treadmill walking with an incline. Backwards step-ups. You can also do the backwards step-ups with a weight. Backwards hopping. And backwards box jumps as well. Now for all of the different tests you have, the backwards hop, give it a try so you can check it out and see what those differences is with patients and compare it to your forward hop and compare the LSIs. Your results will be surprising.